Okay, so today I'm going to be performing the insertion and removal of a female catheter. This is my ID. I'm going to go ahead and show you guys a room. Okay. So before everything, I'm going to go ahead and review my patient's chart for any limitations in physical activity that my patient may have. I'm going to go ahead and confirm the medical order for the catheter insertion. Then I'm going to gather my equipment, and if I need to obtain assistance from another nurse, I will. I'm going to go ahead and perform hand hygiene, and I'm going to go ahead and put on my PPE. I'm going to go ahead and identify my patient. I'm going to do this by asking my patient to state her name and date of birth while I look at her hospital band, and I make sure that everything matches. Once I do that, I'm going to go ahead and close the curtains around the bed, and I'm going to close the door to the room if it's possible. I'm going to do this because this is a procedure where my patient's going to be exposed, so I want to make sure that my patient feels comfortable and that she has privacy. Once I do that, I'm going to go ahead and discuss the procedure with my patient, and I'm going to assess my patient's ability to assist with the procedure, which is if she's able to move, if she's able to flex her legs and everything. I'm also going to make sure that I ask the patient if she has any allergies, especially to latex and iodine. So then after that, I'm going to go ahead and provide good lighting. Some artificial lighting is recommended. This is why maybe I would want another nurse with me so she can be able to hold the light, the flashlight if needed. And I'm going to make sure that I place a trash receptacle within easy reach. Once I do that, I'm going to assemble my equipment to an overbed table within reach. I'm going to adjust the bed to a comfortable working height, which is usually to my elbows. After that, I'm going to stand on my patient's right side if I'm right-handed, or if I was left-handed, I would stand on my patient's left side. Once I do that, I'm going to assist my patient to a dorsal recumbent position with her knees flexed, feet about 2 feet apart, with her legs abducted. I'm going to drape my patient. I can do this with an extra blanket or a gown or another blanket. Once I do that, I'm going to alternately the Sims or the lateral position can be used. I'm going to place my patient's buttocks near the edge of the bed with her shoulders at the opposite edge with her knees drawn towards her chest. And I'm going to allow the patient to lie on either side depending on which position is easier for me and which position is better and more comfortable for my patient. And I'm going to slide the waterproof pad underneath my patient. I'm going to go ahead and already have clean gloves on, so I'm going to clean the peritoneal area with a washcloth and cleanser and warm water, using a different corner of the washcloth with each stroke because we don't want to contaminate or dirty our patient more. And I'm going to wipe from the front to the back, and I'm going to rinse and dry. I'm going to remove those gloves, perform hand hygiene again, and then I'm going to prepare the urine drainage setup if I needed to obtain some urine connection. I'm going to secure the bed frame according to the directions of the manufacturer, and I'm going to open the sterile catheterization tray on a clean overbed table using the sterile technique. After that, I'm going to put on my sterile gloves. I'm going to grasp the corners of the drape and unfold the drape without touching the non-sterile areas. I'm going to fold back the corner on each side to make a cuff over gloved hands. And I'm going to ask my patient to lift up her buttocks and slide the sterile drape under with the gloves protected by the cuff. Then based on the facility policy, I'm going to position the sterile drape, and I'm going to place the sterile drape over the peritoneal area, exposing the labia. After that, I'm going to place the sterile tray on a drape between the patient's thighs, and I'm going to open all the supplies. I'm going to open a package of antiseptic swabs. Alternately, I'm going to fluff up the cotton balls in the tray before pouring the antiseptic solution over them. And I'm going to open the specimen container if I needed to gather some specimen. I'm going to go ahead and lubricate 1-2 inches of the catheter tip with my thumb and my finger and 1 finger of my non-dominant hand. I'm going to go ahead and spread the labia, and I'm going to make sure that I identify the meatus. I'm going to be prepared to maintain separation of the labia with one hand until the catheter is inserted and until urine is flowing well and continuously. If my patient is on the side in the side laying position, I'm going to lift the upper buttocks and the labia to expose the urinary position. So based on whichever position that my patient is at, I'm going to work with. After that, I'm going to use a non-dominant hand to pick up I'm going to use my dominant hand to pick up the antiseptic swab, where I'm going to use forceps to pick up the cotton ball. I'm going to clean one labia fold top to bottom, and then I'm going to discard the cotton ball. Using a new cotton ball each swab for each stroke, and I'm going to continue to clean the other labia fold, then directly over the meatus. So one. Using different swabs each time, different cotton balls each time. With my non-contaminated dominant hand, I'm going to place a drainage over the catheter in a receptacle. The catheter is pre-attached to the sterile tubing and drainage container. I'm going to position the catheter and step within easy reach on a sterile field, and I'm going to ensure that the clamp on the drainage bag is closed. After that, I'm going to use my dominant hand to hold the catheter 2 to 3 inches from the tip and insert slowly into the urethra. I'm going to advance the catheter until there's a return of urine. This is approximately 2 to 3 inches. Once the urine drains, I'm going to advance another 2 to 3 inches. I'm going to make sure that I do not force the catheter through the urethra into the bladder. I'm going to make sure that I ask my patient to breathe deeply, and I'm going to rotate the catheter gently. If there's a slight resistance in the catheter, that means it reached the external sphincter. I'm going to hold the catheter securely at the meatus with my non-dominant hand, and I'm going to use my dominant hand to inflate the catheter balloon. I'm going to inject the entire volume of the sterile water supplied in the syringe. I'm going to pull gently on the catheter after the balloon is inflated to make sure that I feel a resistance. I'm going to go ahead and attach the drainage system if I haven't already attached it. I'm going to remove equipment and dispose it according to the facility policy. I'm going to discard the syringe and any sharp containers and where they're supposed to. And I'm going to wash and dry the perineal area. After that, I'm going to remove my gloves. I'm going to make sure that the catheter tubing is secured to the patient's inner thigh with the Velcro leg strap or with tape. And I'm gonna make sure that I leave some slack in the catheter for leg movement, because we don't want to just attach it real tight, and if the patient flexes her leg, we don't want it to pull. I'm gonna assist my patient to a comfortable position and make sure that I cover the bed with linens, and I'm gonna place her to the lowest position. I'm gonna secure the drainage bag below the level of the bladder. I'm gonna check the drainage tubing that it's not kinked and that the movement of the side rails doesn't interfere with the catheter or the drainage bag. I'm gonna put on clean gloves. I'm gonna go ahead, and if I needed to obtain specimen, I would do that immediately, and I would label it and send it to the lab. I'm gonna go ahead and remove my gloves, any additional PPE, perform hand hygiene, and make sure that everything's put away. So that's for the insertion of the catheter. Now for the removal of the catheter, I'm going to go ahead and make sure that I confirm the order with the medical record, and I'm going to gather my equipment. I'm going to perform hand hygiene and put on PPE. I'm going to go ahead and identify my patient once again. I'm going to make sure that I ask her to state her name and date of birth while looking at her hospital bed and making sure that everything matches. Once again, I'm going to go ahead and close the curtains, close the room if I can to be able to provide privacy, and make sure my patient feels comfortable with the procedure. I'm going to go ahead and discuss the procedure with my patient, and once again assess her ability to assist with the procedure. I'm going to adjust the bed to a comfortable working position, which is usually to my elbow height. If I'm right-handed, I'm going to stand on my patient's right hand, and if I'm left-handed, I'm going to stand on my patient's left side. I'm going to position my patient for catheter, as if I'm going to insert a catheter. I'm going to once again drape my patient, so that only the area around the catheter is exposed. I'm gonna slide a waterproof pad between my patient, which is a female, in between her legs. I'm going to remove the leg strap or the tape or the device that I use to secure the catheter to my patient's thighs. I'm going to insert a syringe into the balloon inflation port. I'm going to allow water to come back by gravity. Alternately, I'm going to aspirate the entire amount of sterile water back to inflate the balloon. And I'm going to refer this to based on the manufacturer's instructions. And I'm gonna make sure that I do not cut the inflation port. I'm gonna ask my patient to take several slow deep breaths, slowly and gently, to remove the catheter. I'm gonna place it on a waterproof pad and wrap it in the pad. I'm gonna make sure that I wash and dry my patient's perineal area. After that, I'm gonna go ahead and remove gloves. This is my patient to a comfortable position. Make sure that she's covered with bed linens. Place the bed to a lowest position. I'm going to go ahead and put on clean gloves to be able to remove any of the equipment that I used. And I'm going to make sure that I note any type of characteristics that I see in the drainage bag. And that is what you do for the insertion and removal of the catheter.